Welcome back in. Artificial intelligence. We hear a lot about it right now and its capabilities, and in turn, the fear that it might be able to do too much. But when it comes to healthcare, some say it's a great tool. This afternoon, we have author and health tech expert Nicole Gibson with us to talk a little bit more about AI. Good afternoon. Thanks for joining us today.
Good afternoon. Thank you so much.
Okay, so let's talk, AI is the talk of the town. Everybody's talking about it. So what can you tell me about AI in terms of healthcare and diagnosis?
So, I think when we look at the history of healthcare, one of the things that most of us can agree is we've had a really highly reactive system where prevention and early intervention, although they've been really big parts of the health conversation for decades and decades and decades, and we all know this is where we should be focusing. Still, when you look at the spend, when you look at the realities of the health of people all over the West, you can see that it's still a very reactive system. And for me, one of the most exciting parts of artificial intelligence and its application with healthcare is how accurately we're going to be able to predict disease, illness, imbalances before it hits this point of crisis. And I think this really empowers the individual to champion their own health in a really new and very personalized way.
Yeah, I think a lot of people will go to a doctor, they have certain symptoms and they're trying to get a diagnosis, or sometimes they end up with a misdiagnosis. So what impact does AI have on things like that and just improving that patient care overall?
Well, because AI is a sophisticated system which is really able to look at complex correlations and patterns. Of course, within that is this amazing ability to be able to diagnose far more effectively than, say, a 10-minute visit to your general practitioner where there's time pressure. They need to see 20, 30 patients a day. They're going off anecdotal symptoms, which is based on the level of the self-awareness of the patient themselves. So within all of that, of course, there's this massive scope to misdiagnose, and you see it across the spectrum of health, from physical health all the way through to mental health. Whereas AI in tracking your behavior and able to look at the full spectrum of the symptoms you're experiencing, we're going to see, no doubt, a massive increase in efficacy when it comes to diagnosis and treatment.
Yeah, I think doctors, sometimes they're trying, obviously, but as you said, they've got a lot of patients, and maybe they don't know you as well as you would like them to, or they're just getting to know you, and so some things might be missed, or some connections, some dots aren't connected. So talk a little bit about biometrics and predictive systems and how they're kind of changing the way people are approaching their healthcare.
Yeah, I mean, I think so many of these biometric tools that we're seeing kind of explode across the world have now kind of just assimilated into this normal part of society, whether that's just your average Fitbit wearer, or someone's using their iPhone for their step count every day, to more sophisticated wearable technologies. I think if we were to go back 20 years, we would really see some of the capabilities of the biometric tech that's on the market as kind of sci-fi. It's really able to get into a read of what activity is happening in your nervous system. How parasympathetic are you throughout the day? Our technology is actually tracking emotional state. Back when we began that journey 2.5 years ago, and using biometrics, heart rate variability, to track emotion through machine learning, everyone was very skeptical around how possible this truly was. And yet here we are with an effective technology that's able to do that. And this is going to continue to accelerate. So think about, from a user's point of view, this is a kind of a self-awareness intelligence explosion. You're able to look back in retrospect and actually see, wow, these are the emotional patterns that are governing my life. These are the things that I'm doing day to day, the tasks that I'm fixed on, that are causing my emotions, my nervous system to dysregulate. I'm able to make more empowered decisions day to day. So when you look at that in terms of preventative healthcare, the number one thing that all health professionals will admit is the most difficult, is inspiring intrinsic behavioral change. And yet, when you look at health outcomes, that is, any health outcome that you're trying to create is totally contingent on your ability to change behavior. Biometrics are this very incredible and very integrated into our daily lives way of shaping our behavior for the better if we know how to use them effectively.
I got mine Fitbit about a year or so ago, and I'm tracking those steps, and it is helping me. But as you said, we are human too, so we actually have to, continue to be motivated and be empowered to help make good decisions. So some really interesting things. Looking forward to the future and what we could see with AI, and when it comes to healthcare, hopefully we will end up with a healthier society. We can all hope for that, right?
That's it. That's what we're aiming for here.
All right. Thank you so much for joining us this afternoon. We appreciate it.
Thank you.
Yep. Take care.